All right, here's our quote for the beginning of part 4. The beginning of part 4. Adversity. Adversity causes some men to break, others to break records. Just a real quick story about this. Remember the athlete? His name was Roger Bannister. Roger Bannister was the first person to break the 4-minute mile mark. Remember that? Prior to that, they said it was impossible for a human to run a mile in under 4 minutes. They just said it was impossible. Then when Roger Bannister did it, like in the next year, like 30 more people did it, like something. And so it just says, hey, when you have an obstacle to overcome, some people let that obstacle hold them back and just say, oh yeah, well I can't do it. Other people are like, no way, I'm gonna break records. So I like that story of Roger Bannister. Okay, now let's learn something about liver diseases. So now that we moved on to the large intestine, if you can imagine, at the end of the large intestine, it's the anus, right? And everything's out by then. So we're going to talk about a few diseases that have to do with the liver, because the liver actually really helps with digestion and detoxifying. So although the liver is not, obviously considered a GI organ, we're going to talk about it here because it does affect our GI system. So let's talk about the liver. The liver has a high regenerative capacity, which means the liver can actually heal itself. It's not one of those organs where once it's dead, it's dead. The tissue can actually regenerate some of its cells. And one of the diseases that we're going to talk about is drug-induced liver failure, where an animal gets into a toxin or a drug and it causes liver failure. We will technically determine that an animal has liver failure if more than 70% of their liver is affected. So once 70% of their liver is affected, we're going to start to see some pretty severe clinical signs, which we'll talk about. Okay. The liver is especially susceptible to toxin ingestion because of a thing called portal circulation. Does anybody know what portal circulation refers to?
Is it the lungs?
All the blood from the GI tract goes to the liver for filtering.
Right, that's what it is.
So the toxins from the GI tract.
That's what it is. So when animals eat things, the reason they have liver failure is because everything that they eat, it's filtered through the liver. So that's why the liver is related to the GI tract. Some drugs have a history of causing liver toxicity, like Tylenol. Don't give Tylenol. Phenobarbital. This is usually what we give animals when they have seizures. And there's some others. Sometimes NSAIDs, like acetaminophen and things like that, might cause liver disease. So let's look at some of the signs of liver disease. I know there's a lot here. I don't expect you to be able to list all these clinical signs. It's just listing some clinical signs that might be associated with liver disease. The most important things that maybe you can star that are going to be kind of specific for liver disease are going to be jaundice. So when you see this yellow color, that can be indicative of liver disease. All the others are kind of non-specific. Hematuria, melena, PUPD, vomiting, diarrhea, anorexia, all those are non-specific. But if you see an animal that comes in that's highlighter yellow like this, we're going to think a couple things. Either liver disease, or maybe they have some hemolysis. Breaking up the red blood cells can also cause this. So that's what we would think about. Also, because the liver's main job is to detoxify the blood, if animals have liver failure, sometimes those toxins will affect the brain, and they may have CNS signs.
This might be a silly question, but how do you check like the CRT or color for dogs with black gums?
It is okay if they're black and not yellow. If they're male, you can do a couple of places. The prepuce. Okay. If they're female, the vulva. Usually even if they're pigmented, look at something. There's usually some area, even if it's like a little spot, pink, look and see if you think it's pink or pale. But that perianal region, any mucous membrane, so that's going to be all the openings. So that's going to be like oral cavity, eyes, rectum, prepuce, or vagina. So some mucous membrane you're going to have to find. But it is kind of hard when they're yellow like this. It's going to be hard to see.
Would paw pads end up being yellow too?
That's a good question. Maybe, perhaps, it also depends on the color, if they're dark or not. But I have seen, yes, the ears will be yellow, the abdomen will be yellow, so I think it just depends on how severe the jaundice is. So how do you diagnose this? Well, there may be some history of it. We're going to talk about toxicities at the end of the term, and animals get into human medication. You know, animals will accidentally take their owner's medication or take too much of it, or they're misdosed. And so there's going to be something in the history maybe that says that. Sometimes if they have a liver toxicity, they'll be painful on palpation. And then all of this is from the chemistry panel. This is all blood work. Again, you guys will learn in ClinPath, if you have not already, which enzymes on a blood profile will give you information about liver health. And we've mentioned some of these before. ALT, bilirubin, ammonia, bile acids. These things will help determine whether or not you have liver disease. Radiographs might show an enlarged liver because it's all inflamed, and so it might be a little bit bigger. And then the best way to determine whether we have liver disease is actually to do a biopsy. We can biopsy the liver, then that's going to be a really good way to tell us, hey, this animal has this particular thing going on with the liver. The only reason you might not want to do this, it says unless, is if they have a clotting problem, coagulopathy. Why is that?
Because then it won't stop bleeding.
It won't stop bleeding. You'll cut off a piece of the liver, and it'll just bleed and bleed and bleed and bleed and bleed. So, also, where do coagulation factors come from? The liver, right? Liver has some coagulation factors. So liver failure can actually cause them to have a lot of bleeding problems.
So would you suspect coagulopathy from just some other signs, or?
Oh, right. Is there something else to tell us?
Yeah.
Oh, is it? So blood work, if they have severe liver disease, based on blood work, like they're jaundice and they have all these increases, what we could do is draw a little sample of blood and test the clotting profile before we actually go in and take a big chunk of liver out. So if we're suspicious because they've already got liver failure, then we're going to try to test their clotting times before. So, or they might have petechial hemorrhage or something. Oh, you see that. And treatment. If there is an antidote is a specific treatment. If there is an antidote to whatever they got into, let's give that. For example, if an animal gets into acetaminophen, the antidote is a drug called N-acetylcysteine. You don't have to memorize that now. It's just to tell you, some drugs have like a drug that will help treat it. So if there's an antidote, let's give that. If not, if it's recent and they've just eaten a bunch of pills or something, we can try to make them vomit those things up. We can give them activated charcoal. Remember I said that's something that can bind toxins in the GI tract. Give them fluids, vitamin K for clotting. So if they have liver failure, they may not be able to clot well. So let's give them some vitamin K. Antibiotics if we think they have a bacterial infection. And then they actually make diets specific for animals with liver disease. So we may have to put them on a special diet till their liver heals. And that is just if you have liver failure because of some drug. Now this is liver tumors. So we've talked about cancer of the stomach. We've talked about cancer of the small intestine. We can also have cancer that affects the liver. It's more common to have cancer spread to the liver than it is to have a primary tumor. That's what that first statement means. Metastatic tumors are more common than primary tumors. Yes?
How, just from the last slide,
Yes.
how long does it actually take for the liver to recover? I guess it depends on the severity.
Yes, I think it depends on what they got into. So, for example, I'll just use a very common toxin that you guys all know about, sago palm toxicity. Sago palm toxicity will cause liver failure in a matter of hours. So, and then the recovery is not very likely. So I think it just depends, as opposed to phenobarbital, which is a drug that we give for animals that have seizure disorders like epilepsy. It can take months or years for them to even get the liver disease. And then it's kind of a slow process. So if we catch it, it's slow enough that we can slow it down in the future. So it depends, is the toxin something that's going to cause a lot of destruction quick? Or is it like phenobarbital where it slowly causes effects on the liver, and if we catch it soon enough, we can kind of wean them off of the phenobarbital or switch drugs. So I think it depends on how much and what the toxin is. So if an animal has liver cancer, then the same thing. Some of the signs are going to be non-specific. Anorexia, lethargy, weight loss, abdominal distension. Maybe the liver will be enlarged because now it has a tumor. The animal may be jaundice. These clinical signs, you guys, again, don't spend a whole lot of time just studying the clinical signs. If I could give you advice about how to learn the diseases, just start off by, if I mention the name of the disease, do you know what's happening? Could you just know what's happening? Maybe even not on a detailed level, just say, how would I describe that disease in 1 or 2 sentences? Just start there. The clinical signs are going to be very general for most of these diseases. Pick out the clinical signs that will help us pinpoint something. Every disease we've talked about causes anorexia and lethargy, so I mentioned that before. So don't spend a lot of time studying these list of clinical signs. Now, how do we diagnose liver tumors? Just like we've talked about before, really when it's going to be biopsying. We can do blood work to look for abnormal enzymes, maybe anemia. Take an x-ray to look for a tumor, biopsy. If they have ascites, because the liver, again, the liver detoxifies the blood. If the liver is failing, sometimes that blood will start to back up and leak into the abdomen. So if they have ascites, do an abdominocentesis, and we might be able to find the tumor cells in the abdomen. We might be able to find those. If we do find cancer, surgical removal is going to be the preferred method. The problem is, if there's a lot of it, or if the entire liver is affected, multiple nodules or something like that, it's going to have a poor prognosis, not going to be very effective. So let clients know the prognosis is guarded to poor. They may only live 6 months to 3 years, depending on the type of tumor and when we found it. So again, cancer usually doesn't have a great long-term outcome, long-term prognosis, but that's liver tumors. Before we start the next section, still on liver, it says, choose your friends carefully because your enemies will choose you. We know that's true. So I put amen to that one. You do not have to look far for enemies, right? They'll be right there. So make sure you have good people around you. Yeah, I do. Okay, a portosystemic shunt. Now this is a really interesting one. I even had a classic case of this not long ago. Okay, the name of this disease is called portosystemic shunt. What I want you to first understand, is what I just mentioned a few minutes ago. Whenever animals eat things, whatever is in the small intestine or the gastrointestinal tract down here, the blood from the GI tract eventually will go to the liver to be detoxified, have all of the toxins taken out of it. Because as your body digests food, sometimes the bacteria will release some kind of toxins that are not healthy for you. So those toxins get taken up into the liver, and the liver detoxifies the blood. We call that portal circulation. Now, remember the concept of shunts. When shunts go around, or shunts go somewhere where they're not supposed to go. Sometimes animals are born with what we call a portosystemic shunt. So just to give you a little bit of organization here, here's the GI tract. This is where all the food is being digested. Bacteria are breaking it down. There's toxins here. The toxins should go into the liver. The liver will detoxify it, and then it'll travel on to the heart through the vena cava. It'll go on to be oxygenated and up to the rest of the body. Now let's look at this picture. Here we have the GI tract, and then we have this extra little vessel here that's not present over there. This vessel is like a shunt. It's a vessel that should not be there. So instead of blood going to the liver, blood goes around the liver and straight into the vena cava, straight to the heart. It gets oxygenated, and then it gets pumped to the rest of the body. But the toxins did not get taken out. If the toxins don't get taken out, it's going to make the animal very sick. So this can be something that they're born with, or some animals might get it a little bit later in life. But here's the idea. Blood bypasses the liver, allowing toxins to go throughout the body. Usually, the most devastating thing about this disease is those toxins go to the brain, and the animals have CNS deficits. I'll tell you about a story I had, a patient I had recently, but this is just another drawing. Here's like a little blood vessel that's kind of going outside of the liver. The blood is not going through the liver to be detoxified, it's kind of taking a shortcut. That's all a shunt is. It's just unfortunately not going through the liver, so the liver can't take the toxins out. So, let's look at the signs. The animal can be lethargic or depressed, ataxic, they're staggering, Sometimes they head press against the wall, like they'll get it against the wall and they just head press. It's because they have all these toxins on the brain. Sometimes they circle, they act blind. It's all because there's toxins on the brain, so all of the things that we see are central nervous system in origin. I had a client come to Palm de Paz. It was a puppy that she adopted from a shelter. She actually was a rescue lady, and she had rescued this puppy. She was just going to foster it until she could find a home for it. Well, when she adopted it from the shelter, got it from the shelter, she said that she changed the diet. She wanted to put the dog on a nice, healthy diet, something with higher quality protein, and she noticed that every time the dog would eat, it would start acting very strange. After every meal, she said the dog would start snapping at things, it would start staggering and acting ataxic, and she just could not figure out why the dog was doing this, but she noticed that it would happen right after eating. So if you can make the connection there, right after you eat, or the dog eats, that's when all the breakdown is happening. That's when most of the toxins are being produced. So all those toxins are being produced, and they're going straight to the brain essentially. And so it was a classic portosystemic shunt case, because we have a puppy who was probably born with it, born with the shunt. Since she changed the diet to something high protein, that made it worse. Let me tell you why protein makes it worse. High protein, increased protein, worsens the symptoms. The reason, we'll say why. The reason is because a byproduct of protein breakdown is what? Anybody know? Starts with an A. It smells really bad. Strong.
Ammonia.
Ammonia. The nitrogen, the nitrogenous waste that are part of protein, they will form ammonia. And so literally these animals have like ammonia on their brain. Very toxic, you can imagine. So this lady, it was so classic because she said, I switched the dog to a high protein diet. And she was just telling us that on the history. She said, well, I switched his diet because he was in a shelter. I put him on a food that was higher protein. And I just noticed that he started acting really funny. Started snapping, started being ataxic. Classic. We did blood work, increased ALT, increased alkaline phosphatase, increased liver enzymes. Very classic for this. We sent the dog to a specialist because we'll tell you how we treat it. It wasn't going to be something we were going to fix right then. I'll tell you one other thing we did though. Send that dog to a specialist. So this is a very interesting condition. So again, how do we diagnose it? Blood work will help be supportive. History and then blood work. They have increased liver enzymes like ALT and alkaline phosphatase. Ammonia levels will be up. Sometimes if the liver fails, then they might have low protein or low albumin or low BUN. This is extreme. This is usually, this is in severe cases. This puppy actually did have a slightly low protein. Because the liver just wasn't functioning. The liver's just not functioning. It's not getting the blood supply that it should. It's not detoxifying the blood that it should. And so usually the liver just doesn't function quite as well because most of the blood is avoiding the liver. Most of the blood is going around the liver. So usually the liver is very small because it's not getting as much blood as it normally would because there's a shunt going around it. So usually the liver is very small. And in some places they may inject contrast material to try to highlight the vessels in the liver to see if they can find that, that shunt. Usually this is something that they go see a specialist for. So the treatment is a low protein diet. Don't feed as much protein. And then surgery. Generally the surgery, like I said, is most frequently done by specialty veterinarians that are really skilled at trying to find the shunt and ligate it. But it's just like we talked about shunts in the cardiovascular system. What you do is you just tie the shunt off so that blood now will go to the liver. It won't bypass the liver, you just tie the shunt off. Now the problem is this. Let me take just a second and go back to the picture so I can show you the picture. I think I'm going to use this picture. See this shunt here? The treatment would be to just tie off this shunt, just cut it, so that blood can't go around the liver. Now blood has to go to the liver. The only problem with that is this animal's body is not used to having all the blood going to the liver. For months, or maybe a few years, blood has been going around the liver. So if all of a sudden we cut this off, sometimes the liver can't handle the amount of blood going there now. Sometimes the liver is like, whoa, all of a sudden I have way too much blood to deal with. Yesterday I did not have this much blood to deal with. And sometimes we can make liver congestion. We can make the liver kind of become congested because it can't handle it. So in those cases, what the surgeon might opt to do is to only partially close it. They have these little clamps, and what they'll do is partially close it so that you get the liver used to handling more blood, and then they'll go back in a few weeks or months later and close it all the way. It's kind of like a gradual fixing. Because you say, okay, rather than cutting this off right away, let me just partially ligate it and then go back in a few weeks later. Okay, so I'll go back to that slide where it's talking about how to treat this. So if we totally ligate it, sometimes that causes an increase in the liver blood pressure. That's what this is, blood pressure. So that's why this point is up here. Partial ligation may be more practical, meaning it might be better just to partially ligate it, then get it back. A second surgery can be performed after a few months to close it off completely. Then the prognosis is pretty good following ligation. Animals probably will do well, but it should be performed pretty early. The sooner the better. The sooner the better. And it is possible for them to have other vessels develop later. That they could get an acquired shunt where sometimes blood will kind of take another route later on in life. That's an interesting portosystemic shunt. Blood doesn't get detoxified because it's going around the liver. You get toxins on the brain. Now they're acting, kind of like CNS issues. Questions about that one? Now we're going to talk about another one you're probably familiar with, which is hepatic lipidosis. Hepatic lipidosis. I know you've talked about a lot about this in nutrition, right?
Still.
So, Still what?
So we're still talking about it.
You're still talking about it, exactly. So in feline hepatic lipidosis, sometimes the distinct causes, we know what kind of puts them at risk for it, but in general, the textbooks will say that the precise cause is unknown. But the animals that are at risk for this are obese cats of any age, any sex, any breed. Usually what can happen is some stressful event happens in the cat's life. They get stressed out. You got a new dog, you got a new cat. You changed their diet. You boarded them for a week or two. They've been sick. For some reason, they stop eating. For some reason, they stop eating. And when they stop eating, their body is like, I need some nutrition. If you're not going to feed me, I'm going to start burning fat. So what happens is anorexia. Anorexia that's prolonged, usually for like 2 weeks or more. It causes an imbalance between how much fat the liver can handle. They'll start to break down fat for energy, but the liver can't clear that fat very quickly. And so now the liver becomes overwhelmed with fat. It causes liver failure, and now you got a worse problem than what you started with. The best thing to do is to diagnose this really early and try to treat it. The way you treat it is make sure the animals eat something, get some nutrition in them so they'll stop burning fat. Unfortunately, I know it's hard to see because of the light, but this is a yellow cat. This is a really icteric highlighter yellow cat.
Comes all the way through their fur and everything?
Oh yeah, can.
Wow.
Especially if they're white, you know,
Yeah.
the skin is kind of pale, then yeah, they can look kind of yellow.
Is that cat even alive?
And this is what the liver will look like. The liver is usually like a brick red color. Here it kind of has a yellow tint because fat is kind of yellow. If we were to take biopsies of the liver, which we would do because that's how you diagnose this condition, the liver would have all these big spaces in it. If you look at this slide, what looks like space is fat. Fat actually looks like big bubbles on a slide. You think this is just empty space? That's actually what fat looks like. So this would be normal tissue. So if I told you the purple areas were normal, you can see that there's not very many purple areas. It's almost all fat.
The dots?
Huh? Yeah, these are the nuclei of the cells. So those are the nuclei. Here's the cytoplasm of one cell. Nuclei, so then kind of the cytoplasm of another cell. Nuclei, cytoplasm. So the nuclei are the dark spots. So this is all normal tissue. Everything else is just fat. That's too much. It's too much fat. So we would biopsy this to tell. And again, clinical signs. This might be a case where the client brings the cat in, a fat cat that hasn't eaten in a while. Hepatic lipidosis is going to be on their minds. Maybe they're yellow, okay? But they could have anything else. They could be depressed, have vomiting. You never know. So again, the clinical signs can be kind of variable. You don't have to memorize that list. I just want you to be familiar with how the animals may come in. And then usually what we will do is do a whole array of tests. We'll do blood work to check liver enzymes. We will do a CBC, a complete blood count, to look for evidence of stress. We might take x-rays to look at the size of the liver. Is it big? Is it small? We could do an ultrasound. That US, that actually stands for ultrasound. So I know it. US equals ultrasound. So we could put an ultrasound probe on the abdomen and look at the liver. And we could take a biopsy. This just means vacuoles of fat. Vacuoles of fat. So again, it's going to be history and clinical signs. Cat hasn't eaten. It's already fat. The body has burned fat for energy. Now the liver is overwhelmed with fat. And when they go into liver failure, they're going to get sick. They're going to be vomiting. They're going to be lethargic. They're going to be icteric. But again, it takes us having to run tests in order to diagnose this. So we got to get some nutrition in them. We got to stop them from burning fat. Let's get some nutrition in. So let's try to feed a high protein, calorie dense diet. You guys learned in nutrition, cats need protein. You don't like to feed them a whole lot of that carbohydrate kind of food. Feed them higher protein diet so that they're not burning so much fat. If they won't eat on their own, give them a feeding tube. This cat has a tube going through its nose into the esophagus and the stomach. This is temporary. You just put it through the nose, and they may have to be sedated for this. Put it through the nose, and then you just syringe feed them through the tube, and that will get nutrition in them. That's temporary. If you need something more permanent, you can put in a gastrostomy tube that's in the stomach, esophagostomy tube through the esophagus, a jejunostomy tube that's in the jejunum. You can put a duodenoscomy tube. You can put tubes anywhere in the GI tract to give them some nutrition. NG stands for nasogastric. Nasogastric. And again, this is usually short term. This is temporary. But the gastrostomy tube, esophagostomy tube, those can be a little bit longer. We had to do that in one cat here. One cat here had such severe upper respiratory infection that she would not eat. They could not get her to eat. They were trying to syringe feed her for many, many days. And we finally just put it in an esophagostomy tube. And the students fed her through that until she started eating again. But we didn't want her. She was a thin cat. She wasn't obese anyway, but we just didn't want her to get hepatic lipidosis. But she didn't eat for a long time. And she still did fine. So you can leave these tubes in place for a couple weeks if you need to. And again, treatment, in the meantime, while we're trying to get them healthy, let's keep them hydrated. Let's give them metoclopramide, which is an antiemetic to prevent them from vomiting, and monitor them just to make sure that they continue to eat. For clients, CE is client education. Make sure that you try not to stress your cats out if you know that they're prone to being stressed. I have a cat